Hello viewers, good morning to all. I'm Ron Grant coming to you live and direct from 284 Media in Tortola, beautiful British Virgin Islands. As the territory of the Virgin Islands continues to maneuver through the global pandemic that is COVID-19, both government and health officials continue to advocate for as many residents as possible to be administered the AstraZeneca vaccine, which is available here in the Virgin Islands to those who wish to receive it. Though not at all mandatory, it is essential. It essentially is the single most important mechanism we have here to really lessen the curve and impact of COVID-19 in our territory. Here at 284 Media, we continue to bring you a range of local health experts to educate and raise awareness on the AstraZeneca vaccine, answering essentially all of your questions. Joining us live is one of our leading health professionals here in the British Virgin Islands, Dr. Heskith Vanterpool, Medical Director of Eureka and Bougainvillea Clinics. It's a conversation you don't want to miss, another opportunity, viewers, to be informed and get the facts firsthand. We'll be right back after a word from our sponsors. You're watching 284 Media. Viewers, welcome back. Thanks for joining us. Dr. Heskith Vanterpool, thank you so much for your time this morning, and welcome back to 284 Media.
Thank you, Ron. I'm happy to be here. Thank you for inviting me. I'm excited to be that we are living in a time when we now have several effective vaccines against this deadly virus.
Indeed.
So I think we are looking at a light. We are beginning to see the light, our way out of this pandemic. And with the vaccines, it should not be too long before we are able to come out of this disastrous position, especially if people continue with their efforts to wear masks, wash hands, socially distance. We are right on the cusp of coming out, so we don't want to discontinue these preventive measures too early.
Wonderful.
So
now, from your seat,
that's important.
From your seat, Doc, what has the response, or how has the response been thus far throughout the community on the vaccine? Are persons willing or apprehensive?
Initially, people were a bit more apprehensive, but there were many people who were ready to run towards the vaccine. As I was one of those that was ready to get it as soon as it was available. I did get it pretty early on. I think more and more of the population have reached a point where they're ready to take the vaccine. We just seem to be getting a bit low on the supplies.
Correct.
We need more supplies, and more people will be taking it.
Now, both you and your wife, like you mentioned, were among some of the very first to receive the vaccine as healthcare frontline workers. Tell us about your experience from beginning to end. Well,
I was the country was a little bit slow to jump out once they received the vaccine. It took about a week before they administered the first doses. I was a little concerned about that, but eventually it happened, and since then, it has been rolling out fairly smoothly. I think the government has reached around 4,000 vaccination doses given so far. When the time came we started with healthcare workers among the first group, and both myself and my wife are healthcare workers. She's a nurse, I'm a doctor. She works in the pharmacy also. So we were among the first, and plus I have 2 clinics with just on the staff that work with me in both the Eureka Medical Bougainvillea Clinic as well as the Medicare Pharmacy Group and Lab Group is just around 100 people. And we, plus other persons that work for me, we have probably close to about 50% of them vaccinated up to this point.
Okay.
So with regards to my experience, the vaccination was essentially painless. I hardly felt it going into my left arm. It was very, very essentially painless, and it did not hurt. Even up to now, I can still hit my arm pretty hard in the area where the vaccination was given. I didn't have much of a reaction there. For the next 12 hours after getting the vaccine, I had absolutely no symptoms. Then later that night, after working and about to go to bed, I began to wonder whether or not I had a little bit of arthritis or the flu. Mm-hmm. And then during the time I was sleeping, I remember quite a bit of a time thinking, geez, this is like the flu.
Correct.
Or possibly a mild attack of dengue, which I had some years ago. And I was thinking whether I should get up and take some paracetamol. Nevertheless, I did not have to get up, and by the morning, 6 o'clock when I got up, the symptoms disappeared quite quickly. My wife, on the other hand, by 7, 8, was feeling a bit cold in the feet and achy, and she went to bed early. So her feet were cold like ice for a while. She didn't have a fever. Neither of us had any real fever, even though it felt it could be a little bit febrile, but we didn't really have fever. And by the next day, her symptoms were gone, and we have been fine ever since.
Okay.
So I think the minor symptoms that we experience, there are other people that experience more symptoms than
Definitely.
we do. Some people get a real high fever, a lot of aches, headaches, stuffy nose. A few people have vomited. But typically the symptoms do not last more than 24 to 36 hours, and people are back to normal. The younger people seem to have a little more of a rougher time than the persons in their 60s and 70s.
Now, we've heard a lot about the day after side effects. Are there any known long-term effects of the AstraZeneca vaccine?
To this point, no known medium or long-term side effects of the AstraZeneca vaccine. As like most other vaccines,
yes,
these symptoms that I have described earlier are often felt after a day or 2 or 3, or maybe even up to a week after having a vaccine by injection. And so these are not unusual symptoms or what we would call reactions. I don't want to even call it side effects, because these are reactions. Your body is reacting to a foreign substance that has been injected into it and is learning how to fight this. This is a practice round, so to speak. You inject the vaccine, yes, the body learns to practice how it's going to deal with COVID the next time it comes.
Correct.
So that's basically it. No long-term side effects so far, and no deaths.
Wonderful. There have been a number of comparisons, Dr. Vanterpool, as it pertains to the brand of vaccine that we have received here in the Virgin Islands. Of course, we have the AstraZeneca brand. Let's put vaccines on a whole into perspective. Would you say that there is significant difference in what we received in any way? Are we at a disadvantage or betterment because of the brand?
Okay. This is a very important area of consideration at this time. Typically, the World Health Organization, the CDC from the United States, and this similar body from the UK would have been happy if these vaccines were shown to be anywhere from 30 to 50% effective.
Correct.
Okay, they would have been very happy that this was what we were able to achieve. Instead, what we achieve is significantly more. The first couple that came out were the Pfizer vaccine and the Moderna vaccine, and they say they were like 94, 95% effective against preventing symptomatic COVID infections. When the AstraZeneca vaccine came out, there was a little bit of conflicting information about how effective it was. With one dose, they said it was like, but if one protocol said it was like 66% effective. Another one that was tested on a small group of people where they gave half the dose initially followed by a full dose after 4 weeks said it was like the 80 to 90% effective.
Yes.
But the most of the study was done with the full dose and full dose. So they got a smaller 66 or 60% effectiveness. However, the best news that has just come out of Scotland, they have shown that persons who receive only one dose of the AstraZeneca vaccine and followed for 4 weeks or more, just one dose, they had a 92% reduction in hospital admissions from COVID compared to persons who did not get the vaccine. And actually, in the same report, the Pfizer vaccine had an 85% effectiveness at preventing people from being admitted to hospital with severe COVID. Now, since these were not head-to-head or neck-and-neck comparisons, we would say that both of these vaccines showed that they are very effective at preventing severe COVID. Remember, if we were to, there's an interesting point that we must make here in the BVI. In the BVI, we test every single person that comes in and so on. And every person with the slightest symptoms, we do a test.
Right.
And so the 153 cases that we have reported are basically mostly asymptomatic people. We have not had any very sick people. We had one that died. Of course, she had to be very sick. And there have been a couple of other people. But we have not had significant numbers of admission to hospital from COVID here in the BVI, despite having, I think it was 153 positive tests so far. So we are getting these tests because we basically do a procedure on everybody that comes into the BVI. When you look at probably United States and England, people are getting tested because they feel sick. They're not getting tested to any great degree because they are traveling or because they are asymptomatic, okay? So they have more severe COVID in their places. And what is being shown is that the vaccine prevents the severe COVID. It might not prevent a test in the nostril from showing a weekly positive test.
Correct.
Showing that viruses are present in your lining of your nose. But so you may still get a positive test after the vaccine. But in general, those people who get that positive test, it's only lightly positive, and those people after the vaccine are at much reduced risk of transmitting the virus.
Understood.
And at much reduced risk of getting sick from the virus.
Wonderful. Thank you for that clarity, because as mentioned, there have been a lot of talks about whether a brand is different, and we are happy to see that what we have received is just as worthy and notable as others. Now, in interacting with a lot of persons in the general public on a daily basis, Dr. Vanterpool, and getting community feedback, I have been told by many persons, well, if enough people take it, I don't have to take it. Others of all ages, varieties, have outrightly said no. We are aware, of course, that it's by no means mandatory, but as we seek to lessen the curb and impact of COVID-19 in the BVI, would you say that such sentiments are the best approach?
Such sentiments are ill-placed. And unfortunately, there are many people in high positions who have influence on the public who speak like that. Indeed. And that's not a good thing. The vaccine is safe. There's absolutely no doubt that the vaccine is safe. We can't say that somebody will not have a few people will not have a severe adverse effect. But let me just put some other things in perspective. Coming back to your thing about herd immunity.
Yes.
I've been following the number of cases that are recorded worldwide. And recently, when I checked, maybe a couple of days ago, there were like 114 million people recorded as having proven COVID infection, of which more than 2.5 million had died. So we are looking there at approximately a 2.5% death in patients who are tested positive for COVID worldwide. In the Caribbean, we have had about 550,000 to 600,000 people testing positive, of which we have had over 7,000 dead from it.
Yes.
In other words, in the Caribbean, we have seen something like 1.3 to 1.5% death rate from people testing positive for COVID. Now, coming back to, going on to vaccines. Every day, the number of people vaccinated is increasing. So the last time I checked, there were like 240 million people had already received the doses. So we had 114 million people receiving, testing positive with COVID, and about 2.5 million dying from it. We've had a roughly 250 million people vaccinated already, 240 million people vaccinated. And of those, we have had little or no serious side effects.
Okay.
And we have no good evidence that anybody has died from any of the vaccines, be it Pfizer, be it Moderna, be it AstraZeneca, be it the new one, Johnson & Johnson that just came out. And then, of course, there are other vaccines in Russia and China, and a couple of others being developed in India. Now, I don't know that all the figures have been clearly collated. So when I say there's no deaths, I don't have 100% proof that statement is correct. But it's not a big problem in relationship to the vaccines. That's what I would like to say.
Understood. Now, should we be taking that stance, though, in regards to if enough people take it, then I don't have to take it? Is that the right approach?
All right, that's the point I want to get to now. I think it's wrong to do that, because if the more people that say that, the more people will prevent us getting to that magical number, what we call herd immunity. There is a concept in vaccinations overall that if a certain percentage of people either got the disease or got vaccinated, then it's more difficult for the virus to spread from person to person, and it's more difficult for the virus to find that person who has not yet been vaccinated or who has had the disease. So the person saying that if enough people get vaccinated, then I don't need to get it. So they are trying to hide among the herd.
Correct.
Let's say a herd is 100 people, okay? We need something like 70 to 80% of people, possibly even up to 90% of people to be vaccinated or to have had the disease before we can say that we reach herd immunity, and that therefore those other 10% of people are unlikely to get the disease. But a lot of those same people that are saying they want to hide among the herd in the BVI, those are people that want to travel overseas. And every time they get on a plane and go elsewhere, they're not necessarily in a herd in that environment, and so they can still get it.
And be exposed.
So we can't continue to hide in the BVI and think that, we can't continue to avoid getting the vaccine and then want to travel outside of the BVI and think that we are not going to get it. We can get it when we are traveling.
Indeed.
And you can get it when the ports open and lots of people start coming in, we may get more disease coming into the BVI, and persons not vaccinated are still at risk of getting the infection.
Understood. Now, many persons are also of the opinion, Doc, that getting the vaccine is going to prevent you from contracting COVID-19, period. Now, however, based on the age-old understanding of vaccines in general, we know that this is not necessarily the case. Vaccines don't prevent you from contacting anything. Speak to that, please.
Well, I think I'd like to couch that a little differently. The vaccines are there to prevent you from getting sick from the infections.
Okay.
The possibility of the virus sitting in your nostrils or sitting on your skin or sitting on your hand is not necessarily going to be prevented by the vaccine. But once the virus wants to penetrate into your body and cause sickness, then the antibodies that you have formed because of the vaccine will attack the virus and prevent the virus from making you very sick. You may still get a small sniffle or something, it's possible.
Right.
So minor symptoms are still possible. And certainly if we test a person with the swab in their nostrils, we can come up with a positive test. But typically those people are not going to be sick enough to need medical care or to be admitted to hospital. And so far, we're not having any deaths from this procedure. I want to make another statement. In Israel, as of recently, about 70% of the Israeli population have already received their first dose of vaccine. And what they found is that immediately after getting the vaccine, people seem to get more infections because it appears that their behavior changed. They were feeling, no, I have the vaccine, I could ditch the mask, I could change my behavior. So more people get exposed. Whereas if they didn't have the vaccine, maybe they were taking all the precautionary measures. But then after a week of the vaccine, we see the numbers going way down. Okay. And 3-4 weeks after, the number of cases of positive and sick people from the COVID really went way down.
Now, with that in mind, in addition to the vaccine, what else should we be doing to protect ourselves as a territory?
In a recent Zoom discussion a group of us had,
yes, we're going to get to that.
Dr. Georges brought up a very interesting point that I had not thought of before. He said, there are two forms of protection that we need to have. Our external protection that we wear and the internal protection. He said in terms of, we all talk about tetanus. We know, most of us know about tetanus. You go outside, you barefooted, you get stuck with a rusty nail. If you didn't have your jabs, you can possibly get this severe condition called tetanus. So when we go out into the yard, we wear some shoes so that things don't stick us. We look around, make sure we don't step on rusty nails, because even though we may have on shoes, a rusty nail could still penetrate. So that's like washing your hands. So you wear your boots or your shoes to prevent you getting exposed to the tetanus spore or to the organism. But in the event that you did get exposed to the tetanus, you should have already had your tetanus vaccine to prevent the virus on the inside. I mean, this is a bacteria, right? Tetanus. So it's an organism. And so you have external preventative measures and you have internal defense measures. So the external defense measures, social distancing, washing hands, wearing your mask. That's the external protection. The vaccine now is developing internal protection and ability to fight the virus should it break through the external preventative measures.
Now, with the new variant strains that we've been hearing about, should we be concerned that the vaccine will probably no longer withstand other strains that may be introduced into our territory? Should that be of concern?
There is an element of concern there. It would be wrong for me to say no. We know of a strain in South Africa against which the AstraZeneca vaccine did not perform very well in one study. We know of the UK strain at which the AstraZeneca vaccine seemed to be quite effective. There's another strain that came out from Brazil, and the same strain was also found in Japan. And that, again, we don't know. We probably haven't tested AstraZeneca much against that particular version. But a very important point here is that the quicker we could bring this, the transmission of this disease under control, the better. Because the more people who get infected with the virus, and the more the virus has an opportunity to multiply, that each time the virus multiplies, it can make, it has to, basically, the system is that the viral RNA is, for the spike protein, is injected into a person. Your body then makes, back up a little bit. The virus attacks a body and then starts to multiply, to duplicate itself. And each time it duplicates, it runs a risk that it could make a mistake in the duplication. And whereas most of those new mistakes aren't of any survival benefit to the virus, and that strain of virus dies away, a few cases can become more virulent and develop greater ability to infect at a faster rate, and also to infect more severely. So we need to bring this thing under control as fast as possible through vaccination, and we are likely to see fewer strains emerge. But in the event that as these strains emerge, the vaccines will have to go back and they'll probably have to tweak it and come out with, you get the program on your phone. Every couple of weeks, the iPhone brings up a new, a new version of the
consistently updating.
Yeah, you got to consistently upgrade and update your software.
Understood. Now, in the final analysis, the taking of the vaccine to many is not only a duty to protect self and family, but a civic duty as we seek to move the territory of the Virgin Islands forward and lessen the curve, as we said, to the impact in the territory. In closing, Dr. Vanterpool, can you speak to our viewers on this very important civic duty and responsibility and leave them with your last bit of encouragement as it pertains
to thank you very much. This is a very important point. Since February of last year, we have been under severe restrictions in our ability to travel in and out, and our economy has suffered pretty severely, particularly the aspects that depend heavily on tourism. So our tourist industry, and so a large percentage of the population are severely affected economically. For us to be able to open back our country to tourism, then we need to have our own selves protected against the virus coming in, brought in by persons from the outside. And we need to make sure that the persons coming in are also protected, preferably that they too should have had the vaccine before coming. And we too, if we are going to be able to travel, we will need the vaccine, because it's not going to be long before your COVID passport has to be shown. So a record of your vaccination has to be shown when you travel from one country to another.
Absolutely.
And if you're going to go on a cruise ship, ultimately the cruise ship, only people vaccinated are going to be able to go on the cruise ship. And possibly only people vaccinated are going to be able to go on an airplane. Possibly only people vaccinated are going to travel to another country. So I think this is hugely important. So for your own sakes, for the economy of the country, and for the protection of your relatives and for your friends, please have the vaccine. The vaccine has been shown to be very safe and extremely effective in reducing symptomatic COVID and reducing people getting sick and dying from this deadly pandemic viral disease.
Dr. Vanterpool, thank you so much for joining us today. Now, viewers, Dr. Vanterpool, along with Doctors Ronald Georges and Mahendra Karpan, held an in-depth group discussion and presentation hosted by the Rotary Club Sunrise, which we will be re-airing right here on 284 Media this Thursday at 6:30 p.m. Make sure to tune in and check that out. Viewers, that's all the time we have, but that is not all the content. Be sure to follow us for daily updates on 284media.com and like us on Facebook for 284 Media and 284BVI on Instagram and Twitter. And of course, join me this evening at 6 p.m. for our evening news as I deliver your daily dose of local, regional, and international content. Some of the headlines we'll be covering this evening include the Sebastian's restaurant. They set the record straight, saying we would not intentionally flaunt the regulations. BVI's Rekoy A.R. Bratwitz sprints to number 8 in the world and number 1 in the NCAA. The VIP celebrates its 50th anniversary under the theme Reignite the Vision, and the public outcry for better facilities sees restrooms at Long Bay Beef Island ready for public use, as well as internationally reggae icon, regionally that is, reggae icon Bunny Wailer has died, and we continue to look at the daunting gun violence over in St. Croix, where a record of 8 persons have died within 4 days. We have all those details for you this evening at 6 p.m. 284 News, your source for honest and impartial news, right here on 284 Media. I'm Ron Grant. Have a good rest of the day. Happy Wednesday, everybody. See you later.